Hello, in this video I am going to explain some abnormalities of QRS complex of ECG graph. Normally the voltages of three standard bipolar limb leads are measured from the peak of R wave to the bottom of S wave, which varies between 0.5 and 2.0 millivolts, with lead 3 usually recorded as the lowest voltage and lead 2 as highest voltage. In general, when the sum of all voltages of all the QRS complexes of three standard leads is greater than 4 millivolts, the patient is considered to have high voltage ECG. Causes of high voltage QRS complexes. The cause of high voltage QRS complexes is usually increased muscle mass of heart, which ordinarily results from hypertrophy of muscle in response to excess load on one side of the heart. For example, the right ventricle hypertrophy is caused due to stenotic pulmonary valve. Stenotic means decreasing the width of the valve, and other is the left ventricle hypertrophy, which is caused by highly systematic arterial blood pressure. The increased quantity of muscle generate increased electricity around the heart. As a result, electrical potential recorded in ECG graph are greater than normal. Decreased voltage of electrocardiogram is caused by some cardiac myopathies. As fluid easily conducts electrical currents, so when pericardial effusion is caused, a large portion of electricity flow around the heart. This effusion causes short circuits and the electrical potential generated by the heart is decreased, which show decreased ECG voltages in the electrocardiogram. Pleural effusion, in which fluid is accumulated around the lungs in the pleural cavity, so it can also cause short circuit around the heart, and as a result voltage is decreased in ECG. In pulmonary emphysema, there is excessive quantity of air in lungs, which decreases the electrocardiographic potentials because here lungs act as an insulator and prevent the spread of electrical voltages from heart to the surface of the body. So as a result, electrocardiographic potential in various leads is decreased. Cardiac hypertrophy causes prolonged and bizarre pattern of QRS complex. The normal QRS complex range is 0.06 to 0.08 seconds, while prolonged QRS complex it may long to 0.09 to 0.12 seconds. When Purkinje system is blocked, it decreases the velocity of impulse conduction about 1/3 of normal. And when there is bundle branch block, then the duration of QRS complex usually increases to 0.14 seconds or maybe longer than this range. Destruction of cardiac muscle in various areas through the ventricular system or multiple small local blocks in conduction of impulses can cause bizarre and QRS complexes. Thank you for watching. I hope you understood the abnormalities of QRS complex. So must like and subscribe the channel.